Everything around. There we go. Oh. There we go. Okay. All right. Hello, Amanda. Oh, hey, Kat. Just told everybody you'll be watching along. So remember, the stuff at the end here is going to be pretty good. Woke up with a headache. Oh, that's the worst. So yeah, a lot of times, before I get started here, I'll just kind of ramble a little bit about the neck and the shoulders. They're so closely related, but a lot of times when we're sleeping, we can tighten up, and all the muscles in the back of our neck will radiate pain, and kind of like this, I'll call it a horn shape on the side of our head. That's called a cervicogenic headache. And some of the stuff that we get to at the very end today, with some of the stretches and exercises for our necks and shoulders, can be very helpful for that stuff. So stick around to the end, or just revisit it later when it's on IGTV or YouTube. But that stuff's going to be pretty good. Like I was saying before, the neck and the shoulder and the thoracic spine are so closely related. Oh, my beautiful wife joined. Hi, babe. So they're so closely related, you kind of have to work on all of them at the same time, because if there's dysfunctions in one of them, the neck, shoulder, or thoracic spine, there's going to be dysfunction in the other places. It's kind of hard for one to work poorly and the other two are just yeah, we're fine. So if you're having neck pain, if you're having shoulder pain, sometimes we gotta look at both. And we're going to be going through just a series of mobility stuff, stretches, and a couple exercises that might be unfamiliar for you. Hey guys, so we're going to go through all this stuff, and if anything is bothering you, just sit it out. Maybe work on your chest breathing that we talked about your belly breathing that we talked about on Monday with low back stuff, or find a posture that agrees with you. Once again, this isn't intended to treat anything specific. We're just going over stuff that can provide you with some knowledge and the ability to keep your shoulders and neck healthy. As we sit here in quarantine, we're constantly rounded over like this, and it's putting a lot of stress on the back of our neck as we sit at our screens and our computers, and it's putting stress into our thoracic spine or our mid-back. So we're going to do some stuff to address all of that, maybe some stuff that you want to take out and look at doing maybe once an hour to break up that sitting. Hopefully you guys will find this helpful for your necks and your shoulders. We're going to be starting on our hands and knees. Oh, and one thing, if you don't have it, I want you to grab a towel, or a belt, or a t-shirt, or something that you can pull on that's not going to rip and it's not going to stretch, okay? So it shouldn't be a rubber band or anything. I have a little, just a hand towel. Doesn't need to be a big beach towel or anything like that. Just a short hand towel will do. But we're not going to need that here for a couple minutes. We're going to go through a series of exercises on our hands and knees to strengthen our necks and our shoulders and mobilize those as well. So I'm just going to set the microphone up here a little bit better, so maybe you guys can hear me, and then we'll get going. Hey guys, thanks for joining. All right, here we go. Okay, so the first thing we're doing is cats and camels. It's a great exercise to mobilize your thoracic spine, get your shoulders going, but it also shows how closely related the neck, the mid-back, and the low back are all together. So we have to move them as one during this exercise. We want to get all this range of motion between our shoulder blades and our neck and in our low backs, because if we're only getting motion in one area, say our neck moves really well but our mid-back doesn't, we're going to put a lot of stress into that area if we go into extension or if we go into flexion, and that's the only place we can do it from. It's going to become an area where we have an overuse injury. So we want to make sure that we maintain mobility and flexibility in all the areas of our spine. So you're going to start with your wrists underneath your shoulders and your knees underneath your hips. And for the cat, it's like a big scared cat. So you're going to push up nice and high, and then you're going to drop down low, and you're going to want to lift your head with this. And then push away, and then lift up. And we're doing 10, so we're at 3. And 4. And make sure you tuck your pelvis under too, okay? We want motion happening in the entire spine. Two more. Good. And we're going to revisit that in a different position in a little bit. So if you didn't get them all in, don't worry about it. We're still going to be going through that spinal flexion and extension. So we're going to stay in this quadruped or hands and knees position, except we're going to put one hand on our low back. You're going to push away with your down arm and open up towards your hand, or the side that your hand is on your low back. So I'm pushing away, and I'm pulling back with my top shoulder, trying to make sure I keep my shoulder away from my ear. You want to kind of make an anti-shrug. And we're going to make 8, so I think I've done 4. I made it a point to count better today. So 2 more on this side, and then we'll switch. And we're just working on, once again, extending one side of our spine and flexing the other. And the effect of that is actually rotation. That's what causes rotation, when one side of our spine flexes and the other extends. So we're going here. And now if this bothers you, if this position, getting your hand behind your back, bothers your shoulder, just put it right on your chest. And you can still do this. You're going to get a little bit less range of motion in your shoulder blade, and that's okay. But we're opening up. And just making 8 reps. And remember to push away with that down arm. You're going to turn on a bunch of your shoulder stabilizing muscles on that side. If you load it up more by shifting forward, you'll feel that. I think I got 2 more left. I'm really pulling back, turning my head. If it hurts your neck to turn your head, don't turn your head. Okay, so we flexed and extended our spines with cats and camels, and we did T4 rotations. We're going to stay on our hands and knees, and we're going to do a couple things for stabilizing our neck specifically. Now to do this, we want to push away from the floor, like we're kind of at the top of our push-up, but we're going to be hands and knees. From there, we're going to rotate our heads side to side, and we're going to side bend. Now when we rotate, we want to look over our shoulder, but when we side bend, we keep our nose to the ground and we just tilt our head side to side. So we're going to do 5 of those to each side, and we're going to alternate between the 2. So you're on your hands and knees, you're pushing away from the floor. This is going to lock out the middle of your back, your thoracic spine, so we don't get the side bend or the rotation from our thoracic spine. We get it all from our neck. So we're pushing away, and you're just going to look over one shoulder, and then over the other 5 times to each side. And you should feel the muscles on the side of your neck really doing this, because they're part of the muscles that rotate. But there's some of the muscles that rotate our spine, or our neck. Great. Now we're going to do the side bend, where you bring your ear towards your shoulder, you keep your nose towards the ground, and you're still pushing away from the floor. And maybe you feel like you go more to one direction than the other. I know my neck is tighter on the right side. Still pushing away. Great. So we want to make sure that your thoracic spine is really locked out there, so you're really pushing away so we get the movement here. Now, it's not uncommon to feel a lot of stress there if this isn't something you've worked on frequently. A lot of times we kind of focus our training neck down, and we kind of just assume our necks are going to go through the motions. But a lot of times that leads to us fighting against this forward head position with nothing. We're not training ourselves to be in better posture, and therefore we get a lot of stress in the back of our neck. We end up with those cervicogenic headaches, those neck headaches, or the neck-related headaches that kind of streak on the side of our head, or maybe even pierce you right in the front of the forehead. Those are pretty specific to a certain type of headache from the muscles in the back of your neck getting really tight. And if we're not training those with some actual specific strength exercises, maybe you can do them while you're planking even, or bird dogs or things like that. If we're not training them, how are they going to get any better? They're not. We're training them to be, you know, really short in back and really stretched in the front. So we want to actually maybe incorporate into some of the movements we do some neck strengthening exercise. We can use gravity. We don't need to use rubber bands or weights or anything for that. So if you followed along with the hip or the back stuff, you know that I talk a lot about keeping our hip flexors in a short position when we're sitting. You know, a lot of times with the upper body, we're here, we're on our keyboards or we're on our phones and we're kind of relaxed with our shoulders up here all day, and our upper traps are going to get really tight because we're just leaving them in this short position. And so what do we want to do? We want to tell them when to turn on, and we want to tell them when to turn off. And how do you do that? You got to use them. So I know that we shrug all day, but I actually want to shrug some more. And this is one of the exercises we're going to need our towel for. We're going to be doing some isometrics. So our muscles aren't actually going to make any movement, but we are going to be using them, and that's an isometric. When we use a muscle and it doesn't create any motion at our joint, that's an isometric contraction. And so if you're going to do like a bicep curl and we're holding a weight here, the muscle's working isometrically, but the weight isn't moving. We're going to do the same thing with the shrug. So you're going to take your hand towel, your strap, your belt, t-shirt, whatever it is, and you're going to actually put it underneath your shins. So it's going to pull you a little bit into a taller posture, and you're holding on. You're going to be as tall as you can through your neck, okay? I don't want you to try to do this one with the forward head. I don't want you to lean your head back. You're just getting really tall. And we're going to make 5 3-second long shrugs where we're pulling and then relaxing. And we're going to pull up and relax. And remember, we don't want to be here, and you don't want your head here. You're getting a little bit of movement where your shoulders come back, and then relax. It's not a pure isometric because there is a little movement, but we don't want a big shrug. We just want to tell those muscles when to turn on and turn off, because after this one, we're going to be stretching. So we've told the muscle when to turn on, we've told it when to turn off, and this is the best time to stretch it. So you can just sit comfortably back on your heels, or you can go into tall kneeling. It's up to you. But we're going to stretch our upper traps. Our upper traps are those muscles that bring our shoulders up. We have another one that we'll talk about in a second. If I want to stretch the right side of my neck, I'm going to tilt my head to the left. I'm going to give gentle overpressure with my left arm, and my right arm is just going to hang by my side. I'm going to hold this for 1 minute. Maybe we're doing this and we feel a lot of stretch and it's really, really intense here on the side of our neck. It's a great place to stay. But if you don't feel that stretch, if you don't really feel anything, you bring your nose and you turn it towards your left armpit and adjust your hand a little bit and pull down. And you might feel a little bit more stretch there. This is stretching a muscle called your levator scapula. It sounds like what it does. It elevates your scapula. It's called the levator scapula. We're just letting that right arm hang. We've got 20 seconds left. Then we're going to stretch the other side. Just breathing gently. We're not trying to rip our heads off. You know, we've seen like a lot of those like YouTube videos of the chiropractors like pulling really hard on people's heads and getting all the cracks. I know my brother loves those videos, but we're trying to just gently stretch these muscles. Stretching is something that you should want to do again. It's not something that you're like, the more is not better when it comes to stretching. Comfortable is better. You should feel a nice gentle stretch. We're going to go to the other side. Comfortable is what we want. Because what we're doing is we're kind of introducing an input to our nervous system, our brain, our spinal cord. We're saying, hey, check this range of motion out. Do you like it? And if you're pulling really hard, your brain and your nervous system are going to say, I don't like that. And you actually might end up being tighter if you stretch harder. Whereas if it's just relaxed and it's gentle, your body might go, oh, I kind of like that. And it will actually calm down and loosen you up. And that's how stretching should be. That's how stretching should work. That's how yoga, when you're doing your stretches, you're in yoga, that's how that should be. It should be gentle. You shouldn't feel like your muscles are going to rip off your body. All right. And yeah, about a minute or so. I think I got that one pretty close. So we're going to revisit the cats and the camels, but we're going to be in this seated position. And we're going to work a little bit more on our thoracic spine, your cervical spine, but we're also going to start moving our shoulder blades a little bit more. You might feel what your arms or your shoulder blades are doing, more so than when you were doing the cats and camels on your hands and knees. And what you're going to do is you're just going to have your hands are going to be out here. You're going to reach forward and cross your arms. And as you do that, you're going to bring your head down. And you'll see how much my spine moves. I'll show you from the side. We're going to do 10 of these in each direction. So you're going to reach and cross. And then when you pull back, you're going to open up your hands. You're going to pinch your shoulder blades. And you're going to extend back. And here, we can start to see how our thoracic spine, our shoulders, and our neck kind of all have to work together to produce movement. And you breathe out. And breathe in. And out. And we have 4 more. Your head is moving with it. Stretching as you reach forward between your shoulder blades. And I think we got 1 more. Okay. So we were working in that pattern of our shoulder blades. We were starting to go out away from our spine to give it some range of motion, or some space to produce flexion. And then our thoracic spine was kind of getting out of the way, allowing our shoulder blades to then come together and create retraction. And so when we go to reach overhead, we should get some extension, but we need mobility in our thoracic spines for that. All right, we're going to need our towel, strap, belt, whatever it is again, and we're going to do some more isometrics for our posterior rotator cuff and the mid-trap muscles, those guys that sit between our shoulder blades. Once again, simple, not necessarily easy. So you're going to take an underhand grip about body width apart on the towel, on the strap, on the band, whatever it is. You're going to pull apart 1, 2, 3, and then just relaxing. As you do this, you'll see my shoulders come down a little bit because they're trying to create a nice stable position for my rotator cuff to work at its maximum function. So pulling apart 1, 2, 3, and relaxing. Now I'm going to make 3 more. 1, 2, 3. Good. And this is our last one. 1, 2, 3. Anybody has any questions, just type them in. I'm going to review them all at the end, and I'll post them to my story. I'll try to get to everybody's questions, and I'll answer them in my story, so look back after. We're going to move on to our next exercise. So we're going to create that same pull. We're still going to pull on the towel, pull on the strap. We're going to pull, so we're creating that external rotation, and then you're going to reach up to about eye level, and you're pulling the whole time, and then relax. And you pull, and up to eye level, and relax. And it's as hard as you make it. So if your shoulders are bothering you, maybe you pull a little more gently. Then if you really want to get those shoulders fired up, maybe you're about to do a nice at-home workout while we're in quarantine, and you just want to wake your shoulders up a little bit, this is a great one. And you should feel the muscles between your shoulder blades also working. I'm going to do 3 more. And I'm not going fast. 1 and 2. And maybe we're getting a little bit of clicking and popping in our shoulders while we do this stuff, and that is usually totally fine. It's normal. We got a lot of tendons in our shoulders. As long as it doesn't hurt. If we get some cracking and snapping and popping and it's hurting, that's when I say it's probably time for you to consult with a medical professional, either your doctor, a local PT, maybe myself for a telehealth visit. Anything like that, anybody who's going to be able to kind of say, hey, that is an issue or it's not. But if it's just snapping and popping and cracking and it's not hurting, it's usually not an issue, and I'm not too concerned about it. So we're done with the towel. We're going to do 2 stretches, 2 neck-specific exercises, then we're going to finish with a nice stretch for the front of our neck after we use those muscles, okay? We're doing on time. We're doing great today. Trying to keep it a little shorter than 40 minutes. So we did this stretch last week for our shoulders. It's called the sleeper stretch. It's to stretch out some of the rotator cuff muscles and some of the muscles that are on the backs of our shoulders. If you have a pillow, you're gonna want it, but you don't need it. But you're gonna lay down on your side. You're gonna rest your head. You're gonna have your torso straight up. Okay, you don't wanna roll back, and you don't wanna roll forward. You're gonna bend your elbow, relax your head, and you're gonna push that bottom arm down towards the floor. And you might not get this range of motion. Maybe you do, maybe you don't. That's okay, but you should feel a stretch on the cap of your shoulder, maybe even in the back of it a little bit. We're here for 1 minute, and this is definitely one you do not want to force. The goal isn't to touch the floor. Everybody's got different range of motion in our shoulders. We're all built very differently in our joints. And sometimes that leads some people to have this is the end range, and that's okay. Or maybe you get a little bit more, and that's fine, or maybe less. Some people out there who maybe just had surgery a while ago, and the rotator cuffs are still a little bit tight. Maybe certain people do a lot of pressing, use their arms a lot, carrying kids around, and their range of motion is really limited. And we've got about 15 seconds left. All right. And 3, 2, 1. All right, so we're popping onto the other side. I'm gonna get my left arm here. Just did a huge pull-up and rowing program earlier today, so my shoulders and arms are on fire while I'm doing these. All right, and so we're just here a minute and just relaxing a little bit after pulling the towel apart. Isometrics can really, really challenge our muscles and help generate some power and some great end ranges or ranges of motion. Hope everybody's having a really good Wednesday or halfway through the week, whatever that means to everybody now. I'm still doing some, virtual visits, so try to remain in a somewhat of a schedule. Still make sure that I have a weekend. On Friday, we're going over hips and knees too. I know a lot of people have been asking for knee health stuff. But once again, it's kind of like the shoulder and neck. It's hard to pick it apart. Hard to pick the knee apart from the hip and the ankle. So we're going to be doing stuff for both of those joints as well. All right. So we got our sleeper stretch out of the way. And now we're going to do a stretch for our pecs, okay? If our pecs are tight, because we sit here, we're rounded forward, and our pecs internally rotate, and that's where we spend most of our day, driving, on our phones, watching TV, eating, all that stuff is in front of us. We don't stretch into this extension range of motion very often. And if we do, we maybe rotate our body a little bit, and that's actually not extension, that's rotation. So we want to actually work on shoulder extension. This can help us put our arms above our heads much more comfortably. If we're doing some overhead pressing, maybe we get a lot of pinching or impingement, people call it. This next stretch can help out. Now, a lot of people will say, I stretch my pecs in a doorway. You might find this stretch to be a little bit more intense than that, and it should be up here in the shoulders. Now, if this causes your arms to go numb or your hands to go numb or burn or any of that stuff, just back off a little bit, maybe just take it easy, and just wait for the next little neck exercise that we have coming up in a minute. You're gonna sit down. You're gonna put your arms behind you with your fingers pointed away from your body. From here, you're gonna scoot forward, but leave your hands in place. And you're gonna just keep going until you feel a stretch in the front of your shoulders. Now I'm just gonna be here. I got a clock down there so I can watch. But here we are, just breathing. You wanna stay nice and tall, kind of push away from the floor. You don't wanna slouch in here. This isn't gonna get you very much stretch. But if you push away and broaden your chest, you should feel a pretty good stretch in the front of your shoulders, right through here, okay? And we're coming up on the halfway mark. I like holding my stretches for 1 minute. There's a lot of research out there supporting that. 1 minute is kind of the minimum. 5 minutes would be the max. And anything short of that or anything longer doesn't do very much more than that middle range. That 1 minute to 5 minutes is your sweet spot. We have 15 seconds left, and then we're going to be laying down on our mats or the floor. Doing 2 neck exercises and then 1 more stretch. 5 seconds left. Stretching our bicep and our pecs and our deltoids. Oh, all right. Okay, so felt a nice stretch here. We're kind of done with the shoulders for now. We're going to be doing the neck a little bit more for these next 2 exercises. They're quick. They're definitely not easy. So we got our head, which is like a balloon, and it's on top of a straw. That's not a very stable setup there. So we have to have all these muscles in our neck that help it from falling over. And like I was saying before, we ignore them a lot. We're very good at being in this position, which kind of shuts those muscles off. Same thing with our core muscles. And we should actually think of our neck muscles as part of our core. We think our core is here. Well, your core muscles are just muscles that help stabilize and move your spine. But our spine goes up into the base of our skull, so why do we ignore this little, 5-inch section between, the base of our skull and our collarbones? We shouldn't. And so these are like little abdominal crunches for our neck. And then we're going to do kind of like a Russian twist, but for our neck. And so you're going to lay down on the ground, legs wherever you're comfortable. If you like them straight, put them straight. I like mine bent for this. And what you're going to do is you're going to bury your chin into your throat towards the ground. Now, I can't talk while I do this, so I'll try to show you a couple reps, and then you're going to do a couple at home. So you're going to bury your chin into your neck. And then you're going to lift, and you're just going to go up and down about 1 second in each direction. Now, when I put my chin into my throat or into my neck, the back of my neck should lengthen. And that's undoing all that short back of the neck stuff that we see when people are sitting, the stuff that can cause those headaches, the stuff that can cause TMJ from poor positioning, is those muscles in the back of the neck being tight. And so you're going to bury your chin into your throat and lift 5 times. Keep your shoulders out of your ears. And you want to make sure you keep your teeth together. All right. So I did 5. Do my little crunches for my neck. And I want to keep the reps pretty low at first because a lot of people haven't done things like this. Yes, it's part of your crunch, but most of the focus when people are working on their abs is here, and they're not focusing on what their neck is doing. They're actually usually extending like this, actually feeding into the dysfunction instead of bringing their chin down. That's one way that you can incorporate your neck strengthening into other things that you're doing. And now we're going to do that little Russian twist variation of our neck, which is just lifting and then going side to side. And we're going to be having to create stability in our neck, so we're using these little stabilization muscles, but then we have to use the big global ones that really get tight on the sides, our SCM, our suboccipital triangle, our scalenes, all these guys that are tight on the sides, fronts, and back of our neck have to create rotation, so they can't help keep our neck up. So the small guys have to. So the big ones are going to be producing rotation, and the small ones are going to be doing the stabilizing, which they should be doing. So you're going to tuck, lift, and then rotate side to side 5 times before you go down. We're just going to do 1 set. So it's a tuck, lift, and rotate. And that was that. So those are the 2 neck strengthening exercises. We had the isometrics for the upper traps. We had the ones on your hands and knees where you're doing the side bend and the rotation, but those ones are really, really specific to get these SCM, to get this big muscle in the front of our neck called our platysma. Just know that it's working the neck flexors, stabilizers, and rotators. So we worked those muscles on the fronts and sides of our neck, and now it's time to stretch them. So a lot of people are familiar with that upper trap stretch that we did earlier. It's going to get the side of your neck. But we want to get the front and the side a little bit more. We want to get this SCM to stretch a little. And so you're going to look up towards the ceiling, and then you're going to tilt your head away. So if I want to stretch my right SCM, I'm going to look up and to the left, and I'm going to do that. And what you can do is you can actually pull down on your collarbone a little bit to get more of a stretch if you need to. I don't need to do it, but I'm just going to show you. So I kind of put my hands on the top of my collarbone. I look up and away. And you want to keep your teeth together during this. And you might feel that whole stretch just down the whole side of your neck and even into your face. In this one, this SCM can actually shoot headaches up into your eye, behind your eye. Even into your jaw. Can be confused with TMJ, or can be contributing to TMJ as well. And we're going to be there for 1 minute. Close. Now we're going to the other side. So I'm going to hold down, look back, tilt away. Once again, if anything's bothering you, if it's hurting, just find a position that you're comfortable with. And about 20 seconds left. All right, so we talked about a lot of concepts for shoulder and neck pain today. There's a lot of stuff in there. What's the reason for keeping your teeth together? Well, if you open up your mouth while you do that, you'll feel less of a stretch, or you should probably feel less of a stretch. So you want to keep them closed just to really get as much stretch in those neck muscles as you can. Migraines that you get. Oh boy, yeah. So migraines often can be hormonally driven, but can also be driven through muscular tightness as well. Always worth a shot. Yes, Katie, it's going to be saved. It's going to go to my IG story. It's going to go to my YouTube. It's going to go to my IGTV as well. Patty, thank you so much. Neck rotations, thoughts. Are you talking about circles? I'm not a fan of these. Let's see here. Let me try to work my way through some of these comments while I got you guys. Thanks, Kat. All right, let's see here. By the way, thank you for so many people joining. I hope that you're finding these guys helpful and useful. Let's see here. We got another PT student in the house. That's awesome to see. I'll reach out to you a little bit later. Once again, neck rotations. I'm not a big fan of circling your neck. I think that it puts a little bit too much stress on the joints in the back called your facets. That's nice, Josh. Yeah, so that is it. Any recommendations for pillows, neck, shoulder pain? Oh man, pillows are usually very, very subjective. It's up to the user. A lot of people have to go through a lot of them very often. General recommendations, keeping your head in a midline is usually the safest place. Any tilting side to side allows for some muscles to be strained or even the joints to be strained. So if you're a side sleeper, something that fills in this whole gap here is good. If you're a back sleeper, you want a thinner pillow. If you're a stomach sleeper, you're going to want a thinner pillow. A little bit of a tilt down is okay with a back sleeper, but stomach sleeper is, first of all, I would encourage a stomach sleeper to become a side or back sleeper, but that can be very, very difficult to do. Let's see here. The neck's being so tight. I hear it all the time. A lot of times it is a stability issue showing up as a mobility issue, meaning that we don't have very stable necks because we keep them in this one position so long that they just become weak. And because of it, our bodies say, here's a bunch of muscle guarding to help you be stable, because we should have lots of control in our neck because it's an area that has should have lots of range of motion, therefore we should have lots of control. So why do I always pull muscles in my shoulder? That could be, we talked a little bit about thoracic spine dysfunction. If you have really stiff thoracic spine, that can lead to some inefficiencies in the power production in our shoulders. Mom, was that your pillow question? Yeah, so like I said, this is going to save to my YouTube, Instagram, TV, and it's going to be on my story for another day or so. And yeah, if you have any questions, please reach out. It's my pleasure to help you guys out. Hear popping when I do certain exercises in shoulders and hips. Well, we have a lot of structures in there that can rub over each other, and that's typically what it is. Usually it's a tendon going over a bony prominence. It is not usually an issue unless it really hurts, in which I would encourage you to go get a medical evaluation. But for the most part, they are pretty benign and can be managed with some stretching and strengthening, and they usually can go away. All right, Kate, yeah, I'm glad that you're still running. Okay, guys, I am going to sign off here. I'm going to get home to my beautiful wife, and I think we're having tacos tonight. Made some homemade tortillas and then chocolate chip cookies too. So everybody have a great rest of your Wednesday. Have a great rest of your week. I will hopefully see you on Friday for hips and knees. Stay safe, stay healthy, and please reach out if you need me. I'm here for you. All right, guys, I'll see you next time.